Hey ladies, looking for a reason to touch yourself? This is self-care on a whole nother level. In today's video, I'm going to tell you everything you need to know about breast self-awareness. Let's get into it. Hello, welcome if you're new here. I'm Dr. Tiffany Woodus, and I'm a wife, a mama, and an OBGYN on a mission to eliminate women's health disparities. This channel was created to educate, elevate, and empower you to take back control of your health narrative. So if that sounds like something you're interested in, please be sure and subscribe below. Now, you may be aware that breast self-examination, which refers to the regular, repetitive self-examination of the breast with the goal of detecting breast cancer, is no longer recommended. This is because we have found that it can lead to an increased risk for false positive test results, and we have been unable to consistently verify benefit or that it improves outcomes. This essentially means women were identifying a problem where in fact one does not exist, and subsequently undergoing further testing and evaluation, which are not without risk, only to find out that everything is okay. Now, even though we no longer recommend routine breast self-examination, we certainly acknowledge the significant value that comes with a woman being familiar with her body. In fact, self-detection of breast cancer occurs in about 70% of breast cancer cases that are caught in women younger than the age of 50, and about 50% of breast cancer cases in women who are 50 years old or older. Spend some time touching yourself, ladies. Get to know your bodies, know your girls. It's important. It saves lives. Now, this is not about any particular method or schedule. This is about getting to know you, know your norm, know your baseline, so that if something changes, you can promptly report it to your healthcare provider. Here's how I want you to approach this. Number one, prepare yourself. Have a discussion with your provider so that you are aware of any particular instructions or things that you need to be aware of. Number two, know the warning signs. Now, do keep in mind that these changes can be seen with other conditions that are not breast cancer. These warning signs include a lump or mass in the breast tissue or in the armpit, any swelling or thickening of the skin, nipple discharge, particularly bloody nipple discharge, skin changes such as dimples, retractions of the skin, or inflammation of the skin, nipple changes such as a pulling in of the nipple or pain in the nipple, pain in any part of the breast as well as any change in the size or the shape of the breast. Number three, avoid examining your breasts when they are more likely to be tender or swollen. If you menstruate, this generally refers to avoiding that week prior to your menstrual cycle. Number four, visually examining your breasts by sitting or standing in front of a mirror with your shirt and bra off. Start by standing with your arms down by your side. Then examine your breast with your hands on your hips, and then lastly, observe your breast with your arms lifted above your head and your palms pressed together. Make sure that you are taking a mental note of all the warning signs that we previously mentioned while standing and observing the breast in each of these three positions. Number five, touch yourself. This can be done while sitting, standing, lying, in the shower. The goal is just to know your norm, know your baseline, know what's normal for you. You want to use the pads of your fingers. Take your time and follow a pattern. It doesn't matter if the pattern is a railroad track type pattern or a radial pattern. As long as you are sliding or gliding your fingers along the skin, you want to avoid picking your fingers up and moving them from place to place, because you want to make sure that you cover all the breast tissue. You also want to make sure that you use a variety of pressure. Light pressure so that you can feel anything that may be just below the surface of the skin, medium pressure so that you can feel in that fatty tissue, and then a deeper pressure so that you can feel all the way to the chest wall or the rib cage. Now, it's important to note that this breast self-awareness is not a substitute for the clinical breast exam, which is when your provider examines your breast. The American College of Obstetrics and Gynecology recommends that clinical breast exam begins at 20 years old, and then it can be done every 1 to 3 years between the ages of 20 and 39, and then when a woman turns 40, it should be done annually. Breast self-examination is also not a substitute for the mammogram, which has been proven to save lives. And according to the American College of Obstetrics and Gynecology, that mammogram should start at age 40 and then can be done every 1 to 2 years. It's also important to not panic. Know that most changes that we identify during our breast self-awareness can be normal and not necessarily related to an abnormality or breast cancer. The breast tissue is very dynamic and undergoes significant changes throughout the month in response to fluctuations in our hormone levels. That's it for today, ladies. I hope you found this helpful. Let's continue our discussion in the comments below. Did you find this video helpful? Do you need a reason to touch yourself? The bottom line is, ladies, spend some time getting to know yourself. It's important. It can save lives. Doctor's orders. If you enjoyed today's video, be sure and watch this one next. I have a feeling you'll like it as well. I'll see you over there. Don't forget to subscribe. Take good care, ladies.